Have you ever had a patient that was dissatisfied with your services? Hi, my name is Amit Gaglani, and I'm a healthcare entrepreneur. And I've had the success and fortune of selling my healthcare company twice. And now my passion, mission, and goal is to help you, the private practice entrepreneur, create the practice of your dreams by putting in systems, knowledge, and experience into your practice to catapult it to the next level. How do we as business owners turn a dissatisfied patient into a loyal patient? In any healthcare practice, patient dissatisfaction can lead to more than just negative feedback. Left unaddressed, it risks losing a patient and damaging your reputation. While attracting new patients is essential, retaining the ones you already have is the cornerstone of long-term growth and stability. The key to achieving this lies in recognizing at-risk patients and turning their dissatisfaction into loyalty. To recover dissatisfied patients, you first need to identify them. The sooner you recognize the signs of patient dissatisfaction, the better your chances of addressing their concerns and improving their experience. Common indicators that we've noticed are as follows: declining appointments. Patients who are skipping their appointments, regularly canceling theirs, or just missing their appointments. Negative feedback. Direct complaints, low survey scores, or unfavorable online reviews. Patients will say something to you when they're being treated that, oh, I don't really see a difference. These are telltale indicators that they're not happy with either their service or they're not happy with their progress. Lack of engagement. Once again, this is like declining appointments. They're just not engaged. They may come to the appointment and say things like, I'm only here because the doctor sent me here. That is somebody who isn't bought into the idea of physical therapy. Abrupt changes. Patients who abruptly stop treatment, their plans, and they have, it's a sunny day outside and they stop coming in. Now, if you can spot these and also educate your staff on spotting these and start addressing them right away, it gives you a better chance to keep those patients coming. So the next question after we've identified who's at risk is, well, what do we do to these at-risk patients? How do we keep them engaged? The best advice that I can give and that we've noticed over the years is reaching out personally. Doing it online is one way, but honestly, reaching out personally is the best way. Your timing, your tone, the method of your conversation is very important. And as a business owner, you have to come across that you're concerned and that you understand instead of being defensive. So listen actively. Don't try to make excuses. Address their concerns promptly. Apologize when necessary, offer an incentive. And what I mean by incentive, it's not a cash incentive. If you offer other services, let's say like massage or a supplement, or you're selling TheraBands or something, offer them something of menial value to you, but something that has value to them, so they are recognized for their loyalty of coming in. Educate and empower them on the benefits of physical therapy and that you are there to help service them. These strategies will help you prevent dissatisfaction. The next step is to take a look at your processes to see what can we do to further prevent dissatisfaction in future patients. Optimizing your communication, set clear expectations. Sometimes patient gets upset about bills that they didn't even recognize that they were going to get because of a deductible they may have not have hit or co-pays that were miscalculated. Be clear in your communication, optimize that communication. Set clear expectations with your staff, do regular follow-ups with the patient. If a bill gets dropped and it gets, the EOB gets processed by the insurance company, let the patient know that this has been processed and what their responsibility is. Try to keep them informed. Staff training in this regard is very important. Sometimes the front desk staff feels that a bill is not their responsibility, that the billing company or the billing department will handle the bill. Studies have shown the more that we can handle the bill upfront when we're face-to-face with a patient, the higher likelihood is of satisfaction as well as the bill getting paid. We want to collect feedback from our patients. I always say a company that cares asks. So if you really want to know the truth, you ask the patients through surveys, through just asking them how they're doing and getting their feedback. Focus on their convenience. If online scheduling is easier for them, look for methods that they can schedule online. Now, every patient loves to cancel online, but no systems are set up to allow for that, for the business reason and also for the reason of that we need our patients to come in with a certain frequency. So honestly, I'm not on board on any system that allows just frequent cancellations online. Create a welcoming environment. When you create a welcoming environment from the very get-go, it allows patients to feel warm to you guys, and they feel like they can reach out, they feel like they can communicate, and that's the kind of environment. If you have a cold environment, patients don't feel that they can communicate effectively with your staff. Turning dissatisfied patients into loyal advocates. Deliver consistent and constant excellence. When patients see that you're really trying to deliver excellence, they notice these things, and it goes a long way. Building a personal connection. If your staff, you yourself as a business owner, are building personal connections within the community and with your patients, that goes a long way of satisfying patients. And even a patient that is upset by something, they let it go, or they're willing to talk to you about it. And that's beautiful when there's a communication that happens back and forth. You can leverage that loyalty in your programs and when you're in your asks too. So that loyalty goes a long way. You can get them to encourage other referrals to come in. So that patient loyalty, it can be a measure of your success. Measuring success is not just patients that are willing to refer other patients, but patients who are satisfied and happy. When they go into the community, they're talking to other people about how well you guys did a great job with them and how much better they are and what they can do now that they couldn't do before. And on the business end, it costs us significantly less to keep a patient satisfied than it does to go out and look for new patients. In summary, I would always say that treat your business as if you think it's a five-star hotel and how everyone in the five-star hotel treats their customers. So your customers should feel that they're walking into a five-star hotel and that they're surrounded by people that care and are willing to listen. If you do that time in and time out, your patient dissatisfaction will be very small. Sometimes they get upset about things that we can't control, but through good communication, those can be solved as well. Once again, my name is Amit Gaglani. I'm the owner of AG Management and Consulting. We help private practices achieve their dreams. If you've liked what I've had to say and you find it interesting and you want more information, please like and subscribe to our YouTube channel and follow us, and be happy to connect with you if you have more interest in the business aspects of physical therapy or your medical practice.